We're qualified. We're tomorrow. That's it. Boom. Not, sir. Wait, are you a native inhabitant? We'll get you in on the native inhabitant. 8:33. This is my friend Daryl Garcia, Noni, when in Guam. Good stuff. Wednesday, April 28th on the link, the Zoom room. Lillian Posadas, hospital administrator, standing by. Good morning, Lillian.
Good morning, Chris. Good morning, Sabrina. Good morning, Jason. And good morning, Guam.
Good morning, Auntie Lillian.
Let's just go ahead and get started because it's getting kind of backed up this morning, Lillian. But I guess we first wanted to start with any type of update on the new hospital because I know you're on that task force, right? Has there been any new developments, new meetings, new information?
It's ongoing. We just had a meeting yesterday. That was our third meeting. The second meeting, which was on the 13th, we basically Mel Mendiola from the CEO from GIDA. She and her team put together a PowerPoint presentation with regards to the various locations, various sites that are being considered for the new hospital. But it's actually not just a new hospital, but a medical center campus that will have the hospital, public health, and behavioral health, and a laboratory, and in one campus. And so that's really what we're talking about. But I think the first priority is the hospital because of our situation here in the hospital. This facility has pretty much met its lifespan of 50 years, and it needs to be replaced. So that's the priority. I mean, public health is also a priority, but I guess the hospital is really what we're looking at to replace first. And so, yes, yesterday we met again, and we were looking at the task orders that were spelled out in the grant that was approved and awarded to the Office of the Governor by the Office of Economic Adjustment. And we're going to be working very closely with the performance-based contractor, which is the consultant, the Matrix Consultants. They've been recognized through the proper solicitation process in 2014 by OEA to, I guess, manage and handle the grants that are awarded by OEA. So they are the consultants that we're going to be working very closely with this first phase in terms of the assessment. And that's all part of the task orders. There's like about 9 task orders to meet that assessment, to complete that assessment, and come up with a strategic work plan for the construction of the hospital. So that was the discussion yesterday.
Was there any more discussion on finalizing or further narrowing any of the proposed sites for the new hospital?
At the last meeting on the 13th, out of, I think, as I mentioned, 10 or 12 options in terms of locations, it was narrowed down to like about 4. And one of them is this current location here where we are right now, combining it with the old site, the Oka Point, the cliff line, right above Hilton, combining those 2 locations to then, have this campus. That was one option. The other option was the Atacao. There's an area in Atacao, and there's an area in Andy South. And I'm either the South Finnegajan, the old Nimitz Golf Towers, golf area. But I am trying not to, I'm trying to dissuade the task force from this location, Oka, primarily because it's going to be a major disruption. If we're going to have a construction here in this facility and continue to provide the services, it really is going to be a major disruption. In addition to, we have no space. Laterally, we can't go anywhere to then, move people so that the construction can be, can continue or can be started. There's just no space here for us to move not only the patients, but also the administrative offices, the non-clinical side. So having it done here, this site is just not at all feasible, not realistic. And really, it's a major disruption for the services that we have to continue to provide. So yes, it got narrowed down to, I think, 4 locations. And I forgot to mention, I'm sorry, the Eagles Field is still part of that, site option.
Wow, Lillian. So it kind of sounds like you're taking Oka off the table.
I am. I'm not, because you got to also keep in mind it's a residential area, so there's really no space to expand. And for those reasons, that it is a major disruption to the services that we have to continue to provide while it's being constructed. There's just no space to expand. We are already challenged with parking issues, and so that's just going to get compounded further. So from my own perspective, Oka Point is just not at all a realistic, a feasible site. And I know people are going to argue with me and debate that with me, but that's the reality of this site here.
Does the governor share your sentiment about using the Oka property?
We have discussed it, and she also agrees that there's just too many limitations for this option, for the site.
Couldn't we get
I mean, learn our lesson, right? I mean, we need to learn our lesson here that this is just, and it being in the cliffside, the salt air from the ocean, it corrodes the facility. It really does.
So I know you don't want it at Oka, but is there any site that you do prefer of the sites that you're looking at?
Well, my preference is, like I said, is the Eagles Field, because it's centrally located, especially for the people of the South. It is near the University of Guam, near the academic institutions, that then we can be affiliated with the programs there, and maybe even expand it to see how we can have medical students. So there's lots of opportunities, even research. If we bring research, get our people to become scientists and do some research on our island. I mean, do you not see that vision?
Yeah, no, there's definitely a lot of stuff to research. That's for sure. Lillian, what's the COVID update at GMH?
The census right now, as of this morning, is at 5. We have picked up, our census has gone up to 5 this morning, and actually was, I believe, 4 or 5 yesterday also. So it's there seems to be a gradual increase, an uptick, and I'm just kind of concerned.
Are any of the patients hospitalized fully vaccinated, or have they received any of the doses?
There was one who was fully vaccinated, and the Abbott test that we conducted on that individual turned out to be positive, but we confirmed it with the PCR. Public Health ran the analysis on the PCR, and it fortunately came out to be negative. So, the initial test with the Abbott, apparently was a false positive.
And is this person still in the hospital?
No, individual was released.
What about the others? Have they got any other shots at all? Because what I hear is sometimes people get the first shot and then they think, "Oh, wow, I'm good."
No, they haven't. The ones who are still here have not been vaccinated, have not received the vaccines.
What about staffing, Lillian? How are you guys on staffing? Have you brought on any new hires?
We brought on new hires. Yes, absolutely. It's a revolving door. We lose people, they resign, they leave, and but so we continuously are hiring people, particularly in the clinical side, nurses, allied health professionals, respiratory therapists, radiology technicians, and so yes, we've hired.
What's the protocol when you guys bring on board new hires from, let's say, like off island? In terms of like for the COVID protocols?
They still need to. That's a standard protocol. Any new hires, part of the pre-employment process is the COVID testing before they start. We need to establish that baseline so that way, we don't discover later on that, oh, they're positive. No, we need to make sure that before they start, we test them.
Are you able to I don't want to, because I just got this tip, Lillian, about a couple doctors who had come in and had, I mean, and I guess the best I could do is ask, but who had tested positive for the virus after displaying symptoms over the weekend. And they were like newer
That's
hire.
the, yeah,
I'm sorry.
Monday.
Can you say that again? Go ahead.
That's the report I received Monday, that there were a couple of doctors who traveled off island and have come back. And again, the Abbott test, well, we're waiting for a PCR, is what I haven't seen the PCR report.
Were these doctors, did they come from hotspot?
I would consider, yes, they were hotspots.
Are you able, was it India?
You got the information? Is that the information you received?
That's the information I received, yeah. So let me just tell you the info I received, Lillian, because I'm sorry, I just got it right now and I had you on. So I got a tip that you guys had hired a couple doctors from India who had come, I think the day before they had that like 200,000 positive COVID cases in India, and that they had been on the job, were given the quarantine exemption, and then ended up developing symptoms over the weekend and eventually tested positive. That you can confirm?
Yeah, I'm not gonna lie, sure, that is information that, I received also. And they're not new hires. These are doctors who've been with us and they've traveled and they have returned.
And so that being said, are you at all re-examining maybe the protocols that allowed this to happen?
Well, yeah, we are, but we want to also make sure that the PCR, because that's basically the confirmatory test. If the PCR tests come back, negative, then that gives us that assurance that they're free of the infection.
Are they still I mean, with the displaying of symptoms and the one positive test, are they still on the job, or were they?
They're right now quarantined, isolated. They're not working until we get the results.
And when do you anticipate getting those?
Well, it should be any day now. I should have it by today. We should have it by today.
And then, I mean, just as the administrator, right? Because God knows during the pandemic, we've spoken so many times about infection with the staff and the risk that they run. Was this kind of a red flag for you, given that, I mean, we had a lot of infection with the staff during the height of the pandemic?
There were, the numbers were up in terms of the staff getting a COVID positive tests, and majority of them were from the community. Not so much that they got it here exposed to patients. There were a few that, who were exposed to the patients, but majority of the cases were that they got it from the community. Because, in-house, the staff are really following the PPE protocols. And so, yes, they're protecting themselves. But yes, majority are from the community.
What did the staff say?
And go ahead.
What was the staff telling you with these two doctors who tested positive? Was there some like anxiety or worry on their part?
Sure, absolutely. There's concern, but everybody again continues to wear the protective gear, and so with contact tracing, our infection control and employee health are following through with the contact tracing.
All right. Is this going to affect, or again, just real quick before we let you go, what's the status on the visitation?
It's still, there hasn't been any change at all with the visitation, other than the last time I mentioned that, patients who are 75 years and older, we are allowing their family, one family member to be with them in the hospital.
Okay, so that's patients 75 years and older. You get one family member. And then are you guys just reviewing the rest of the visitation policy? And do you anticipate any kind of change with that if we reach the pat to half?
Right. We continue to have that discussion, yes, amongst our executive team and our department managers.
Okay. Anything else, Lillian?
Plenty.
I know that you said with the 5 hospitalizations, it caused you some concern. Do you want to kind of share those concerns with us here on the show?
Well, that the numbers are picking up, and they're, the news that, I mean, the good news is that they're not acutely or critically ill to require any of them to be on the ventilator or in the intensive care ICU level of care. So, hopefully that this, stays this way, or that the numbers drop. So, but my point is that this is the new norm. This COVID virus is in our community. It's going to be in our community. And so we need to continue just exercising all the precautions as much as possible.
Amen. Totally agree with that. Lillian, thank you so much for your time and appreciate your transparency this morning and always.
All right.
Okay, Lillian,
Thank
that's
you.
that. There you go. Lillian Posadas, hospital administrator, 849. So, yeah, there you go. The